Hello, Dr. Irene here. Many parents are requesting anti-cough medications for their children. Unless your child has croup or asthma, there is no medication approved to stop the coughing. Many adults are prescribed medications that contain codeine, and although the FDA has issued warnings and contraindications regarding the use of codeine-containing medicine in children since 2013, these drugs still are prescribed sometimes. So even up to 2019, we're seeing them being prescribed. It's important to remember that codeine is metabolized in the liver to morphine. Ultra-rapid metabolizers, especially children with a history of obstructive sleep apnea that typically will get a procedure to remove adenoids or tonsils, can make enough morphine to cause respiratory depression and even death. So in 2013, the FDA issued a boxed warning and contraindication to the use of codeine to manage pain in children younger than 18 years old after a tonsillectomy, and for the treatment of pain and cough in children younger than 12 years of age. Then in 2018, it contraindicated the use of codeine-containing cough or cold medications in all children less than 18 years of age. So after a viral illness, you should anticipate a cough for a couple of weeks. It should be getting better though. It should be gradually improving. If not, make an appointment with us to be examined.